name's Justine and I am a MLD therapist. My background is complementary therapies, myofascial release, remedial massage therapy. But now mainly I focus on manual lymphatic drainage, and I work here at the Renovatio clinic in South Manchester. Primarily I see people with primary and secondary lymphoedemas. I see some people who've had cosmetic surgery as well, but the majority of my patients are referred to me via consultants at Christie or the Nightingale, through the breast care nurses, because they've got lymphoedema. Before I got the LymphaTouch, I was using the HYVAMAT. I've had the HYVAMAT now for about 6 years. I got it when I was newly qualified, and so I was doing generally manual lymphatic drainage, using the HYVAMAT especially for fibrotic tissues, and using intermittent pneumatic pumps as well. One of my patients went and saw another MLD therapist and had the LymphaTouch used on her, and she came back raving about it. And I could also see quite clearly that there'd been an improvement in an area that I'd been struggling with a little bit. So on the upshot of that, that's when I decided to investigate further and look at getting a LymphaTouch myself. And I've not looked back. I find the LymphaTouch is really beneficial with patients who've got secondary lymphedema, for me. A lot of my ladies that I treat are either breast cancer or any gynae type cancers, so there's lots of scar tissue. And scar tissue is very difficult to get through. That's where the myofascial release comes in, which is extremely handy. But with this, I'm able to kind of pull up the dermis at one go and help just with the drainage. So I feel this takes a lot of time from my treatments. This differs from using my hands because it's more effective. The fact that we've got the pressure there, we're sucking up the skin, we're creating a larger area for drainage, and this takes minutes, whereas my hands would take maybe 20 minutes or something. So it improves the lymphatic drainage for the patient as a whole. So using this, I can see the benefits, and the patients can see the benefits as well. I feel like it's just almost like an additional limb now for myself. I use this with the HYVAMAT. Quite often I do have my gloves on and I'm using the HYVAMAT, but then I will have this depending on the area I'm treating. So if I'm treating somebody who's got lower limb lymphoedema, I will have them on their side perhaps, and have the cup fixed because it's able to stay attached to the skin, which is wonderful. So it's working, pumping for me whilst I'm using the HYVAMAT, helping with lymphatic drainage. As well as the HYVAMAT, I'm also using LED, which is brilliant. The infrared is anti-inflammatory, so if I've got an area that's deeply congested, I'm able to use the LymphaTouch first, drain the area using my manual lymphatic drainage techniques, opening up all the pathways, and then using the LED light as well. MLD, we always start at the neck. So first of all, open up the neck area. Let's say for instance, lymphoedemas in the left arm. So open up the neck, open up axilla on the other side as we always do, open up our pathways intercostally around the abdomen, and then usually if there's any fibrotic tissue, I'll be using the HYVAMAT. If there's a large area that's congested, I really do appreciate being able to use this, especially the bigger cup, because it's so big. It covers a huge surface at one time, and I'm able to, once I've opened up everything and we know where it's going to, just being able to fix it on the patient and slide and glide it up all the way across to where I know there's effective drainage. When I turn my patients on the side, quite often they have swelling, lymphedema in this pathway here. And again, this is so effective in being able to just pull up the area and slide it right across the watershed to the other side. So I see a difference, I can see that it's working, and when patients are getting off the couch and saying, well, that feels better, it's not in the way, quite often they say it always feels like something's in the way here, or they message me the next day and tell me that their bra's fitting better, or their cardigan isn't as tight. That tells me that it's working. You can't go against that, it's the results that you see. So all in all, with breast cancer and lower leg lymphedema, it really does benefit with the whole decongestive side of things. What I hope for a patient is for them to see and feel the difference. Manual lymphatic drainage on its own, done very basically, people do see a difference anyway. But then when you've got something like this complementing what you're doing, it increases the benefits and the outcomes. Hopefully we will see a reduction, that their limb may feel lighter, that we'll see the swelling decrease, and 9 times out of 10 we do see that having used